Welcome back to Twin Cities Live. Look at that. You might remember that I had LASIK eye surgery just a couple months ago, live on the show. It was painless, quick procedure. Now, this is the best part. I can see perfectly without my contacts or glasses, and I don't have to wear that hairnet anymore.
That's also a good part. Yeah, Dr. Mark Lobanoff from North Suburban Eye Specialist. He was Elizabeth's doctor. Now he's here to answer more of your questions about LASIK. Welcome back to the show.
Thank you very much.
Hi, Dr. Lobanoff.
How are you?
I'm good. I have one more appointment with you on Thursday morning,
That's
but
right.
So far, I mean, it's been great. I can see perfectly.
So you love the vision?
Love the vision.
And you just flew out to California, New York. How is it traveling without contacts?
Amazing. Like I don't have to bring anything. It is terrific. I just went with my clothes on my back because I didn't need anything else.
Who's hosting the show here?
He's running the show. So the only thing, and this is something I wanted to talk about because the one thing is I'm like addicted to eye drops and I use a lot of them, and there's a little bit of redness in one corner of my eye that I notice when I get tired. So, but you said sometimes that happens.
It's very normal. In the first couple of months after LASIK, the eyes are going to be a bit drier.
Mm-hmm.
And as they get dried out, sometimes you'll have a little redness in the corner. Over the next week to, say, 6 weeks, that's going to go away for you.
Okay. See, that's good. That's
Yeah.
the question.
Very good.
That
Very
you got to
good.
ask
I
for.
know.
Okay.
You're loving it.
But-
Let's get to our questions.
Yeah, because this is something, I mean, this is the most questions I get when I'm like out at the grocery store. People are like, how are your eyes? Everyone wants to know about it. So the first question from one of our viewers, this is Tammy from Cannon Falls, and she writes, how bad does your vision have to be before you can qualify for LASIK? Because she says she has a hard time with contact lenses and don't like wearing glasses. I'm with you on that. Okay, what do you think, Dr. Lobanoff? How bad does it have to be?
You know, it's a good question, and patients say I have a -1 correction or -2, and is that bad enough to require LASIK? And what I tell patients is we don't treat a number. If the patient has trouble with their vision, if it's enough to cause blurring of their vision, we will go ahead and treat it so that we can make their vision better.
Okay, so it doesn't necessarily have to be so bad.
What if
This
you
is
have
good news
perfect
for
eyes,
you.
but you just feel like getting LASIK? Yeah?
Come and see us anyway.
All right. right. Hey, the second question is from Adele.
Adele, maybe?
In Maple Grove. She asks, can LASIK surgery be performed on people whose eyes are changing due to age, and will those eyes continue to change after LASIK surgery? Very good question.
Yeah, this is a good question. What do you think?
Probably the most common question we get is, can we free people from reading glasses or bifocals? And the answer is yes. We employ a procedure called monovision, where we correct one eye for near, one eye for far. And over time, the needs for that near eye change. So someone who's 45 needs less strength than, say, someone who's 65. But with LASIK, we can always go back in, add a bit more treatment, strengthen that reading eye over time. And maybe we have to do this once every 10 years.
Okay, that was another question because I know other people were asking me. I have a friend who got pregnant and had a baby, and then she had LASIK, and then she had to wear glasses again. And you guys, I know, have a great policy as far as that.
We really do. So we stand behind all of our work, and no matter what the circumstances, if someone's become pregnant or something else has occurred, if the vision changes, we'll go back and retreat them at no cost.
That's good.
I got a question for you because people see me. I got my glasses on. I do not wear contacts when I don't have my glasses on. It's just my regular vision.
When he doesn't have
So
glasses,
some
it's
days I
just
feel like
blurry.
helping my eyes, and some days I'm like, the heck with it. So for a guy like me, like if I wait longer, is that a bad thing, or does it not matter, or?
It's really not going to put you at any increased risk to wait. But you probably wear your glasses to drive at night or when it gets dark, or when you just want to see more clearly when you're at the Twins game.
Yeah,
If
that's
you
where I
wanted
really
that
like 'em.
crisp, clear vision all the time without the hassle of carting around the glasses or contacts, then LASIK would work for you.
Is
should
there,
do it.
is there
Doesn't
anybody
hurt.
other than people with perfect vision that shouldn't get LASIK or shouldn't consider LASIK?
There are, and that's why we do a thorough examination for each patient. But there are some patients who have corneas that are too thin, or their eyes are simply too dry, or they have some irregularity of the shape.
And the cornea is that little area over your eye, right?
It's the clear dome of tissue over the front of the eye.
Okay.
So sort of like the crystal on a watch. And if there's any irregularities to that, then we may not choose LASIK. But there are some great options, and probably the best option that's out there now is known as the Visian ICL, or intraocular contact lens.
What is that? Yeah, I haven't
Yeah,
heard
what
of
does that do?
This is a new technology, and we can actually implant this eye here, inside the eye here.
Whoa.
Oh,
So during
Goodness.
a 10-minute procedure, we make a small incision. Through the incision, we fill the eye with a clear liquid gel, preparing the eye for the lens implant. And then we inject a very thin lens inside the eye, thinner than a contact lens. As the lens goes across the eye, it's eventually tucked into position behind the iris. And so it corrects the vision from the inside out. We don't have to touch the cornea. We don't have to remove any tissue. It's safe for patients who are very, very nearsighted, -14, -16. So in a 10-minute procedure, we can restore their vision.
So it's basically kind of like a contact lens that sits in your eye permanently?
That permanently is put in place so that you never have to touch it, you never have to deal with it, and it corrects the vision perfectly.
Oh my gosh, I love how our crew is like shrieking when they
just
see
opened
that.
up a whole
Our
other
crew-
can of worms.
Yeah, but they see that animation and they're like, and I'm like, guys, did you not see my real eyeball sliced open like that?
Well,
apparently
let's not put it that
we have
way.
a squeamish little crew.
Whole other can
Exactly.
of worms here. Now, okay, so all the same questions that come up with LASIK probably come up with that.
Right.
Dangers.
So there's questions about concerns and risks, and it's why you want to go to a surgeon that has a lot of experience. And at North Suburban Eye Specialists, we've implanted more of these Visian lenses than any other clinic in the state of Minnesota. We've had a great track record with it. It's a completely painless procedure, so it's done under anesthesia. Takes about 10 minutes, and the vision is restored instantly.
How about cost? Generally more or less
A little bit
expensive
more
than
because we're doing the surgery inside an operating room. So the costs are about $3,000 per eye.
LASIK? Okay.
Wow.
You guys are really
I don't
smart.
know. I know. They
I don't know how
their
you
stuff.
figure that stuff out and make that work. but
Isn't
wow.
that crazy? It's crazy, but after, I mean, I can see perfectly. It is amazing. My last checkup, my vision was 2015.
That's right.
And so we'll see on Thursday.
My hope is to see you even better than 2015. 2015 is better than 2020. Let's see if we can beat 2015.
Boy, I got to get my eyes ready and practicing.
Cool.
I see E, the big E.
Yeah, you do.
Yeah,
Good.
I can see that.
Thank you, Dr. Lobanoff.
Absolutely.
Thanks,
Thanks
Dr.
for having
Lobanoff. This is great.
If you have more questions, and we know you do, for Dr. Lobanoff, head to KSTP.com, click on Twin Cities Live, then scroll down to the bottom of the page. You'll check out the Exclusively on TCL tab.
Yeah, and you're going to find more information on LASIK and the Visian ICL procedure that we talked about today.
Yeah, and if you missed the surgery, you can also see that on our website as well.
And
We've
this
got
is what
that
I always
archived.
say. If this guy can do LASIK on me and I can see perfectly with producers, photographers, cameras, and getting time cues on when he has to start it, he can do it on anybody. And
Probably.
It'll be fine.
Hey, still to come on Twin Cities Live.